Hi everyone, this is for autistic audience, and apparently I'm getting some comments here where people just trying to discredit me for what I do or what I say. I always make disclaimers. I'm a parent to severely autistic child. I'm sharing experience, and I'm also a pro se litigant for a very long time that I'm sharing my experience and so forth. So, but this is for audience with severely autistic children in reference to pain. I got some of my notes for you. I've got my student over there, right? And this is my opinion. Again, I'm a parent. I'm not doctor, I'm not therapist, I'm none of those, but mine as well, right? So why is it hard to teach pain? Because it's not based on memory. It's not ABA. It's sensory issue, it's feelings. And this is why it's difficult to teach. But because children with autism, they have all kinds of pains, and they cannot just, talk to us. And I watched that post on Facebook where mother lost her child because of that. The child was nonverbal, and he couldn't share with her what pains he had, and he died because of that. And my prayers go to her, and yes, she accepted my friendship too. But this is basically, I'm doing this video in memory of her child that just died recently, and I'm hoping I can help with this video because this is my idea. It's still in the works, and because I was busy with litigations this last week, I didn't do much on that with my own child, so it's going to be pretty much like starting new for everyone. And we're going to be checking your children for sensory. Like my child, he has a dual feelings. Like, I have to do something very hard. I mean, excuse me. He needs to get hurt very hard to feel the pain, okay? He has a very high pain endurance, I'm sorry. And your child can be just the opposite, extremely sensitive, and when you do something, they already feel it. So you have to watch for that first and estimate or establish how they feel that pain level, right? And the second, that's one that is important. You're gonna check the sensory, how they respond to pain before you do what I'm going to be doing here. And again, it's a demonstration. I don't know the outcome. I don't know anything how he's going to respond. I have not done this for a week. I just tested it. That's what I said. I need to kind of shape that up. And the questions you will be asking, and I will be asking him as well, do you have pain? Now, with children that are nonverbal, you can still, and you do want to ask them questions because they understand. They just have blockage. They cannot talk to you back, but they will understand and they will recognize this question that you will be repeating, because it's also going to be associated with the action. Question with action. So, again, totally my idea, okay? You're not going to find this in a doctor manual, and never. Again, I'm experimenting too, so something that works for me may not work for you or for your child, right? Another question is where the pain is. Show or point. Again, nonverbal autistic children, they will be able to point because they're not physically impaired. They have speech delay, they have speech impairments, nonverbal, but they can still use their body as a language communication and to show you if they're hurt. But you're gonna start somewhere to get them used to that pain, what it is, and how does it supposed to feel or similar, because that's something we will never know. We're in our own bodies here, right? We know what our pains are. And so again, you're gonna be doing repetition, repetition, repetition. So this is what I'm gonna do with my boy. Okay, you can see some. Brandon, tell mommy, do you have pain? Show me. So he is showing me incorrect. He said, where do you have pain? And he shows at the stomach. And that's where we started too, because everything is pretty much yes for him. Before it was no, now he constantly, all questions, he does not know how to respond. Yes, but how I know this? I'm also looking at signs. You see, he's writing, he's on the phone, he's verbally steaming, he's engaged. So I know he's not in pain, he doesn't have fever, the vital signs are okay, he's normal self. So I know at this point he should not have pain, but he already given me the wrong answer. So this is why I'm gonna go back and investigate. Just watch this. Okay, Brendan. Do you have pain? No pain. Correct response, by the way. Massage? Yes, I'll give you a massage. Now, Brendan, this is what I come up with. Let me get this a little bit closer because we're kind of moving, right? Hope you can see that. And we're going to be using body parts that they know. That's a prerequisite. Just teach them a couple of body parts first. That would be maybe ear, maybe nose, maybe head, maybe stomach, leg, toe, whatever that could be, right? But here's what we're gonna do. Brendan. Okay, baby boy. Tell me, do you have pain?
No.
No. Okay.
Massage.
Correct answer again, but before he said yes. So he remembered where I'm going with that now from the last time, week ago. Now, Brendan, I'm gonna squeeze that finger, and again, you don't want to squeeze it hard because you need to check the sensory, how they tolerate pain. So for your child, it may not be necessary to squeeze it very hard to make them feel that sensation, right? But for my kid, I actually have to squeeze it pretty hard. Okay, Brandon, do you have pain now? Do you have pain now? Brandon, do you have pain now?
No. No. No.
Do you have pain now?
No.
Yes. Yes. Where do you have pain?
Yes.
Where do you have pain?
No. Yes.
And I'm gonna help him at this point. Finger. You have pain in your finger. Where do you have pain?
Yes.
Finger. Finger. Yes. And then I release. I release and I rub and massage again. And this is why it's a good video, because you see mistrials as well as trials. You know, it's never perfect, but you know, that's the reality. And this is authentication per se. Okay, Brendan, now we're gonna do this again. I'm gonna squeeze that finger and he should say, Brendan, do you have pain now?
No.
No. Now I'm squeezing. Do you have pain now? And I have to squeeze it very hard. Brendan, yes. Where do you have pain?
No.
Where do you have pain?
Yes.
Where?
No.
Finger. Good job. So, and I'm teaching him that too, because he said yes, no, maybe, you know. That's why we come back and do more and more trials, right? So I'm teaching him right now, do you have pain? And I'm squeezing. Then he says yes. Then I release to show him the difference when there is no pain. So you kind of inflicting that pain on them to teach them, right? Okay, let's try. We're gonna try ear. Okay. And look, I'm not doing anything because the body should be resting, no pain, right? Because I don't want him to get confused. So, Brendan, do you have pain?
No.
No. Do you have pain now? I'm pulling his ear. Do you have pain now? Do you have pain now?
No. Yes.
Yes. Where do you have pain?
No.
Where do you have pain?
Yes.
Ears. So see, trial number 2. We keep going. I'm gonna do ear again. I'm just gonna let it rest so he doesn't show him the difference when there is no pain and when there is pain. Brandon, do you have pain now? Do you have no pain now? Good job. Now I'm pulling his ear again. Do you have pain now?
No. Yes.
Yes, self-correct. Where is your pain?
No.
Where is your pain?
Yes.
Ears, yes, ears. you see all these mistrials or incorrect questions, incorrect answers rather, and it's gonna take some time. That's what it takes, the repetition and so forth. So now I'm gonna do the stomach. Okay, I'm gonna do the stomach. I'm gonna ask him again if he has a pain, because right now he shouldn't be. So he should remember that when nothing is squeezed or touched or pressed, that means no pain, right? And then they will be able to generalize when they actually do have a real pain. They will be able to either point or to show. And see, I'm pushing my child to tell me, like ear or the finger. Where a nonverbal child, you would take their hand and show point, ear, point, and you take their finger and you say point at your ear, the ear pain. So eventually, do you have a pain? They're just going to respond with their bodies, okay? So let's do stomach. Brendan, do you have a pain? Do you have no pain? Okay, no pain. Do you have pain now? I'm pushing the stomach. Do you have a pain now?
Yes.
Yes. Where is your pain?
No.
Where is your pain?
Yes.
Stomach. So he did respond self-correct again. And no consistency at this point, but if you keep doing this over and over again, it will get to it. So I'm gonna do stomach again. And we releasing the pressure, the pinching, whatever, how you're gonna stimulate the sensory, right? Or inflict that, again, my child he needs like a lot of pressure, because I already know this from he was a baby, when he was hitting his head, and I thought he would cry and he didn't cry. I was like, what's going on? It's because he doesn't feel pain at the macro level, he needs more to feel it. Okay, that's how, sensory and balance. So we're gonna do stomach again. Brendan, do you have pain?
No.
No. Pushing on the stomach. Do you have pain now?
Yes.
Yes. Where? Where?
Stomach.
Stomach. Yes, that was pain. And be reasonable, right? Don't have to squeeze their guts out or nothing. And I'll do just for the generalization, I'll do one more, and it's gonna be a toe, because he knows this word. And again, you keep going back the full trial, do you have a pain? And you have to let him rest to show him the difference. Then you squeeze, say, do you have a pain now? And then point or respond. I'm pushing him to respond because he's got some speech now. And so, Brandon, let's do your toe. All right, Brendan, do you have pain now?
No.
No pain. Good job. No pain. I'm squeezing the toe. Brendan, do you have a pain now?
Yes.
Yes. Where is your pain?
Feet.
Toe.
Toe.
He said feet, but it's actually a toe.
Toe.
Do you have pain now?
Toe. No.
No. Do you have pain now?
Yes.
Do you have pain now?
Toe. Yes.
No.
No.
No pain now. Do you have pain now?
Yes.
Yes. Where?
Toe.
Toe. Good job. So, this skill, again, will come with repetition. But I showed you pretty much where even to start, because he told me incorrect answer, yes. Then he remembered the week ago that I pointed it out. But then again, you always have to assess the child if they are normal self, before you even do that, because they could be in pain, and they will not learn that way. You need to make sure they're well, not in pain or discomfort of any kind, and then that's going to be your baseline for the pain or no pain. And then you inflict that pain on them, and you teach him what to do. Again, with repetition, he will be able to transition to the point where I don't have to squeeze him, right? And his body will respond. And if he's not acting himself, like stop rocking, or stop being active. That's how I know these are my signs for him not well-being. Then I will be able to ask him, like, where is your pain, and he should transition, because we just generalize from the finger to the ear to the stomach to the toe. He already knows what the pain should feel like. He will be able to transition later when there would be a real pain. So I hope it's helpful. It's a long video too, but it's basically the start. Okay, hope it's helpful, and this is very important because we want to keep them safe, and we want them to communicate on their level to tell us that they need help. Okay, the words should be simple, sentences should be basic with very few words, especially those that are nonverbal or echolalia, or even nonverbal and little verbiage. You still want to have very few words, so they can remember, because that's going to become a command later on. So at this point, I did what I promised. I posted my video again. Disclosures: I'm just a mother with some good ideas and big long-term experience in ABA and other therapies that I'm actually providing to my own child now. So talk to you soon.